Body's response. A cough is your body's way of responding when something irritates your throat or airways. An irritant stimulates nerves that send a message to your brain. The brain then tells muscles in your chest and abdomen to push air out of your lungs to force out the irritant. An occasional cough is normal and healthy. What are the types of cough? There are many types of cough. Some of the names for coughs describe how long they last, while other types describe how they feel or sound, and other types are actual conditions. A cough that persists for several weeks or one that brings up discolored or bloody mucus may indicate a condition that needs medical attention. At times, coughing can be very forceful. Prolonged, vigorous coughing can irritate the lungs and cause even more coughing. It is also exhausting and can cause sleeplessness, dizziness or fainting, headaches, urinary incontinence, vomiting, and even broken ribs. Types of coughs may be related to how they last. Acute cough begins suddenly and lasts for 2 to 3 weeks. Subacute cough is one that stays around after you've had an infection and lasts 3 to 8 weeks. Chronic cough lasts longer than 8 weeks. Long-lasting coughs may also be called persistent coughs. Refractory cough is a chronic cough that hasn't responded to treatment. Types of coughs may be related to mucus. A productive cough, or a wet cough, is a cough that brings up mucus or phlegm. A non-productive cough, or a dry cough, doesn't bring up mucus or phlegm. Types of coughs that have distinct sounds and are related to specific conditions. Whooping, pertussis, or whooping cough, is an infection that causes a cough that sounds like a whoop. Barking. A cough that sounds like barking can be a sign of croup. Wheezing. This type of cough often happens when you have blocked airways. It can be associated with an infection, like a cold, or chronic conditions, like asthma. Types of coughs related to when you cough. Daytime cough. Nighttime, nocturnal, cough. Cough with vomiting. This often happens with children. They cough so hard that they gag and sometimes vomit. Home treatments. Drink plenty of fluids, or use a cool mist humidifier or vaporizer, to soothe an irritated throat and loosen mucus. Have a little honey before bed. Studies show the sweet stuff can help ease a cough. Don't give honey to children under 12 months, though. You may want to try over-the-counter remedies that also contain soothing ingredients such as aloe or menthol. You may want to try natural over-the-counter products that contain very low doses of aspirin. When it is applied to inflamed tissues caused by an upper respiratory infection, it helps reduce the symptoms of sore throat. Calm a wet cough. If it's hard to get the mucus out, or if it's thick, look for medicine that says expectorant. That loosens the gunk to help you get rid of it. If you're having post-nasal drip with lots of juicy mucus, you may do better with a medicine that dries you up like Sudafed, pseudoephedrine. If you have cough with fever or shortness of breath, call your doctor. Also check with them before you use cough medicine for serious conditions like emphysema, pneumonia, chronic bronchitis, or asthma. And don't give cough and cold medicine to children under 4. Calm a dry cough. You may get one with a cold or the flu, or if you breathe in something irritating like dust or smoke. Medicine that says suppressant helps stop your urge to cough. Plus, it can help you sleep better. Cough drops, or even hard candy, can stop that tickle in the back of your throat. Don't give the drops to children younger than 4. Cough medicine in children. Never give this type of medicine to children under 4 years old, because it can have serious side effects. Ask your doctor before you give any of these products to children ages 4 to 6. They're safe after age 6. For children 1 and up, try half to 1 teaspoon of honey to help them suppress their cough. Will antibiotics stop a cough? Usually, no. That's because most coughs are caused by viral infections like colds or the flu, and will get better in a week. Antibiotics only work on infections caused by bacteria. If your cough isn't better after a week, see your doctor to make sure the cause isn't a bacterial illness, like a sinus infection or pneumonia. If it is, you may need an antibiotic. Coughs from allergies and asthma. Allergies can make you sneeze, cough, or both. An antihistamine medicine may help. Some newer ones at the drugstore won't make you sleepy. If you're also wheezing, where your breath sounds like whistling, you may have asthma. Go see your doctor. Smoker's hack. If you light up, chances are you cough, especially in the morning. But it may be a sign of something more serious. Sometimes smoke irritates your airways and causes inflammation that turns into bronchitis. It can also be a warning sign of cancer. See your doctor if you are coughing up any blood or if a new cough doesn't go away after 1 month. What else causes coughs? If yours lasts longer than 8 weeks, a number of things could be to blame. Ongoing coughs can be caused by acid reflux, or gastroesophageal reflux disease. You may hear your doctor call it GERD. Coughs can be a side effect of ACE inhibitors, a kind of blood pressure medicine. They can be a symptom of whooping cough and even heart failure. You need medical care for all of these conditions. Natural cough remedies. A teaspoon or 2 of honey may cut mucus production. Honey also kills germs. But remember, it can cause botulism, a rare form of food poisoning, in babies. Never give it to any child younger than 1. Hot drinks. Hot drinks won't ease a stuffy head, but they can soothe the cough much better than room temperature drinks. Sip on hot tea or water if you're seeking relief. Ginger. Research shows certain purified compounds inside ginger root can relax the muscles that tighten your airways. You can eat ginger raw, or you can mix ground ginger root with honey and stir into hot tea. Water. Drinking lots of water not only soothes the scratch of a cough and keeps you hydrated, but it also thins the mucus in your throat. You're less likely to need to clear things out with a cough. Steam. Breathing in steam may help with coughing because it calms and moisturizes your airways. You can also add essential oils like peppermint to the water for extra comfort. Neti pot. One of the most common reasons for cough is upper airway inflammation. Saline irrigation, or washing out your nasal passages with a salt water rinse, can keep inflammation down by flushing out irritants and clearing away mucus. You can use a special bulb or a container called a neti pot. Elderberry. You can take elderberry extract as a supplement in capsules or syrup. It may not ease your cough right away, but studies show it can make it go away sooner. Menthol. Menthol, a compound naturally found in peppermint, opens your airways to help you breathe more easily. That means it can also keep coughs at bay. Why? You can find menthol in rubs you spread across your chest, cough drops, and even peppermint tea. Gargle salt water. A salt water gargle is usually a sore throat remedy, but it's worth trying for coughs, too. The extra moisture can thin mucus and help wash out things that irritate your throat, much like a saline rinse does for the nose. Mix 1/4 to half of salt into 8 ounces of warm water, tip your head back, gargle, and then spit the mixture out. Humidifier. Though keeping the air moist can help ward off a dry cough, take extra care with humidifiers. Dust mites are the #1 allergen and grow best when conditions are too moist. Mold can also grow inside humidifiers if you don't keep them clean. Both can make coughs worse instead of better. Experts have found that mixing herbs like ivy leaf, marshmallow root, thyme, and aniseed into a syrup can cut the number of days you'll deal with your cough. Cough drops. Sucking on a cough drop, or even just a hard candy, may wet your throat enough that it puts a short-term damper on cough. Your best bet is cough drops with airway opening menthol. Who is more likely to experience a cough? Anyone can get a cough. A cough is the most common symptom reported in healthcare providers' offices. However, some people are more likely to get coughs than others. These include those who smoke substances, like tobacco or marijuana, vape, have chronic illnesses, especially those involving the lungs or nervous system, have allergies, are children. Kids get sick often, especially if they're in daycare or school. What are the most common causes of a cough? There are many things that can make you cough. Some of them include irritants or allergens, smoke, strong smells, like cleaners and perfumes, mold, dust, pollen, pet dander, mucus. Certain medications, like the blood pressure medications known as ACE inhibitors. Acute cough. Medical conditions that can cause acute and subacute cough. Cold, flu, acute bronchitis or bronchiolitis, sinusitis, pneumonia. Whooping cough, also called pertussis, asthma, allergies. Acute second or third hand smoke exposure. Medical conditions that can cause chronic cough, chronic bronchitis, asthma, allergies. Chronic obstructive pulmonary disease, COPD, and other lung conditions. Gastroesophageal reflux disease, GERD. Throat disorders, including vocal cord disorders, post-nasal drip, heart failure and other cardiac conditions. What can be done to control or relieve a cough? Treating a cough will depend on what is causing the cough. If you have an infection, your healthcare provider might prescribe some type of antibiotic or antiviral medication, but most viral coughs do not require antiviral medications. For GERD, they might suggest diet changes or prescribe a proton pump inhibitor or an H2 blocker. Water can be good for a cough. Drinking it can help ease a cough from throat irritation or dryness. Adding it to the air with a vaporizer or a steamy shower are other ways water relieves a cough. Quitting smoking and avoiding other irritants are also ways to relieve a cough. Those irritants may include medicines, scents, like perfume or candles, smoke or allergens. What over-the-counter treatments can I use for cough? There are plenty of cough syrups and cough medications available over the counter for adults. In general, they have not been shown to work better than a spoonful of honey. Cough drops and butterscotch hard candies can help soothe your sore throat. You may also get relief from hot beverages like tea, especially if you put honey in them. You shouldn't give cough medicines to your child if they're under 6 years of age without the approval of their healthcare provider. How can cough be prevented? You can prevent some kinds of cough by avoiding irritants that you know cause you to cough. You can help prevent coughs caused by infections by getting vaccinated for influenza, COVID-19 and pneumonia. Avoiding people who are ill. Avoid touching your eyes, nose and mouth. Wash your hands often with soap and water and or using hand sanitizers. Doctor. When should I call my doctor about a cough? If you or your child has a chronic disease, you should call your doctor for specific advice. In general, call your doctor if you have a cough that will not go away and these symptoms: wheezing, noise when you breathe out, fever over 101.5 Fahrenheit or fever that lasts more than a day or two, chills, phlegm, thick mucus, also called sputum, especially phlegm that is yellow, green, or bloody. Go to an emergency room or call 911 or residents if you have a cough and you feel like you're choking, can't breathe well, see a lot of blood when you cough, have severe chest pain, frequently asked questions. How do I know if my cough is serious? To diagnose what's behind your cough, your healthcare provider will take a medical history, give you a physical exam, and may order some tests. As part of the exam, your provider will check your vital signs, like temperature and the number of breaths you take. They might check your oxygen levels, do a spirometry test in the office, or order a chest X-ray or lung function tests if your cough has lasted a long time. Your doctor may ask if you use or did use tobacco, marijuana, or if you do or have vaped, what kind of work you do, how long you have been coughing, how well you breathe when you are resting and when you are working hard, if the cough keeps you from sleeping well, if anything comes up when you cough, like phlegm or blood, what medicines you take, if you have a bad taste in your mouth, if you have bad breath that will not go away, if you have pain, especially in your face, if you have lost weight without trying. Can pregnancy make you cough? Pregnancy doesn't usually make you cough, but your immune system does change. This could mean that you get a cough or cold while you're pregnant. Also, the cold or cough might last longer. Longer illness. Contact your doctor if your illness lasts longer than you expect or if you have trouble eating, sleeping or breathing. What does it mean if I cough after eating? If you cough after eating, you might have had something go down the wrong way, meaning it went toward your lungs instead of your stomach. Our upper airways are set up to stop food or drink from going all the way into our lungs most of the time. If food does go toward the wrong pipe, it'll make you cough, but it's not usually serious. Sometimes what you're eating or drinking can make it past that protection and actually go into your lungs. This is called aspiration, and it can happen if you've got problems with swallowing or other digestive or lung issues. If you frequently have issues with coughing and eating, let your healthcare provider know. What should I know about COVID-19 and cough? Cough is a symptom of COVID-19. It can also be part of a post-COVID syndrome, or long COVID. As part of long COVID, a cough can continue for weeks or months after you've been infected. You'll probably have other symptoms, too, like feeling very tired, having trouble concentrating or remembering things, and/or having trouble breathing. Contact your doctor about being tested for COVID-19 if you haven't been diagnosed with it yet. If you have, follow the suggestions of your provider about how to deal with ongoing symptoms.